The HCV test blends science with compassion, promoting awareness without stigma, and this balance is essential for meaningful healthcare. At its core, the test is a scientific tool built on molecular biology and immunology, yet its impact extends far beyond the laboratory. How the test is understood, offered, and discussed shapes how individuals perceive themselves and their health. When approached with compassion, the HCV test becomes an invitation to awareness rather than a verdict, helping people engage with their health without fear of judgment or isolation. Stigma often grows in the absence of understanding. Hepatitis C has long been surrounded by assumptions about behavior and personal choices, overshadowing the reality that infection can occur through many routes, including medical procedures and accidental exposure. The test itself carries no blame, but the social narratives attached to it sometimes do. A compassionate approach reframes the test as a neutral act of care, emphasizing that viruses are biological events, not moral ones. By presenting testing as routine and responsible, medicine dissolves shame and replaces it with shared responsibility for well-being. From a scientific standpoint, awareness is a powerful preventive force. When people feel safe to test, infections are identified earlier, transmission is reduced, and treatment becomes more effective. Compassion encourages participation, and participation strengthens public health. The HCV test thus serves not only the individual, but the community, creating a ripple effect of knowledge and protection. This outcome is only possible when testing is normalized and stripped of fear, allowing science to function at its full potential. There's also a deeply human aspect to compassionate testing. Learning about a health condition can be emotionally challenging, and the way information is delivered matters. A calm explanation, a reminder of treatment options, and reassurance grounded in evidence can transform anxiety into empowerment. The HCV test, when paired with empathy, becomes a moment of connection between patient and provider, reinforcing trust in both medicine and the body's capacity to heal. At a philosophical level, blending science with compassion reflects a mature understanding of health. It acknowledges that humans are not just biological systems, but emotional and social beings. Effective care must address all these layers. The HCV test exemplifies this integration by using advanced science to illuminate the invisible while honoring the person behind the result. Awareness grows not through fear, but through understanding, and stigma fades when knowledge is paired with kindness. In this space, testing becomes an act of dignity, offering clarity without judgment and care without conditions, supporting a vision of health that values humanity as much as accuracy. Modern testing transforms uncertainty into clarity and opens the path to cure. And this transformation represents one of the most meaningful shifts in contemporary medicine. For a long time, hepatitis C lived in a space of ambiguity. People carried the virus without knowing, and when it was discovered, the future often felt unclear. Today's HCV testing dissolves that uncertainty step by step. It begins with a simple question about exposure, then moves deeper to determine whether the virus is active, how much of it is present, and how the body is responding. Each layer of testing replaces vague fear with precise knowledge, allowing both the patient and the physician to stand on solid ground. Scientifically, this clarity is powerful because it changes the direction of care. Instead of guessing based on symptoms or waiting for liver damage to declare itself, modern tests measure viral RNA directly. This means the virus is no longer an abstract possibility. It becomes something that can be seen, counted, and tracked. When viral load is detected, it provides a clear target for treatment. When it is absent, it offers reassurance rooted in evidence rather than hope alone. In either case, the mind is freed from uncertainty, and decisions can be made with confidence rather than anxiety. The path to cure begins precisely at this point of clarity. Once active infection is confirmed, treatment is no longer theoretical. Advances in antiviral therapy have turned hepatitis C into one of the most curable chronic viral infections known today. The test acts as the doorway into this possibility. It identifies who needs treatment, guides the choice of medication, and later confirms success by showing the disappearance of the virus from the blood. In this way, testing does not merely diagnose, it actively participates in healing, marking progress and validating recovery through measurable change. There is also a deeper emotional shift that occurs when uncertainty is removed. Uncertainty has a unique weight, often heavier than bad news itself. Not knowing what is happening inside the body can quietly erode peace of mind. Modern HCV testing replaces that invisible burden with understanding. Even when the result indicates infection, it comes paired with a roadmap. There is a plan, a timeline, and a high probability of cure. This knowledge restores a sense of control, reminding individuals that science is not only observing disease, but actively reshaping outcomes. On a broader level, the evolution of HCV testing reflects how medicine matures over time. It moves from reaction to anticipation, from fear to precision. It shows what becomes possible when technology, research, and compassion align. The test is no longer a static label, but a dynamic tool that guides action and confirms success. In revealing the presence or absence of the virus with clarity, it transforms a once hidden threat into something manageable, understandable, and often completely reversible, allowing the body and the future to move forward unburdened by unanswered questions and lingering doubt. Antibodies are biological witnesses, not signs of weakness or failure, and understanding this changes how we interpret what the body reveals through an HCV test. When the immune system encounters the hepatitis C virus, it does not panic or surrender. Instead, it responds with precision, producing antibodies that recognize and bind to specific features of the virus. These antibodies remain long after the initial encounter, not as a mark of damage, but as evidence of vigilance. They are records of a moment when the body identified a potential threat and took action to protect itself. In everyday language, the presence of antibodies is often misunderstood. People hear the word and immediately associate it with ongoing illness, as if the immune system is signaling defeat. Scientifically, the opposite is true. Antibodies exist because the immune system functioned as designed. They represent learning at a cellular level, a memory encoded in proteins that allows the body to respond more effectively in the future. In the context of hepatitis C, antibodies indicate exposure, not necessarily current infection, and this distinction is essential for both medical clarity and emotional well-being. From a biological standpoint, antibodies serve as messengers between past and present. They allow physicians to trace the history of a virus without relying on symptoms or visible damage. The HCV antibody test, therefore, is not a diagnosis of harm, but an invitation to ask better questions. Has the virus been cleared? Is it still present? Does the liver need protection now? These questions emerge because antibodies have quietly preserved information that would otherwise be lost. The body, in its wisdom, refuses to forget important encounters, and antibodies are how that memory is kept alive. There is also a psychological weight carried by test results, and this is where language matters. Labeling antibodies as failure places unnecessary blame on the individual, as if infection were a moral lapse rather than a biological event. Recognizing antibodies as witnesses removes judgment and replaces it with respect. Exposure to a virus can occur through countless pathways, many beyond personal control. The immune response that follows is not a mistake, but a demonstration of resilience. Antibodies tell a story of survival, not of defeat. In a broader sense, antibodies reflect a philosophy of adaptation. Life does not move forward by avoiding all challenges, but by learning from encounters and building strength through response. The immune system embodies this principle perfectly. It evolves through experience, and antibodies are the physical proof of that evolution. In the case of hepatitis C, they stand as quiet evidence that the body noticed, responded, and remembered. When we understand antibodies in this light, the HCV test becomes less about fear and more about insight, less about labeling and more about listening to what the body has already learned and preserved within its own remarkable intelligence. Hepatitis C often remains silent, making early testing an act of respect for the liver and a recognition of its quiet endurance. The liver is one of the most patient organs in the human body, designed to adapt, regenerate, and compensate even when under prolonged stress. When the hepatitis C virus enters the bloodstream and reaches the liver, it does not usually trigger immediate alarms. Instead, it integrates subtly into the liver's daily workload, and the organ continues to perform its vital tasks without complaint. This silence is not a sign of health, but of resilience, and understanding this distinction is essential to appreciating why early testing carries such importance. From a scientific perspective, the liver's ability to function despite ongoing viral activity is both remarkable and dangerous. Liver cells can tolerate inflammation for years, quietly repairing themselves while the virus slowly replicates. Because there is no pain receptor signaling distress, the body does not demand attention. By the time symptoms appear, significant damage may already exist. Early HCV testing interrupts this timeline. It does not wait for the liver to cry out. It chooses to listen before the damage becomes irreversible, honoring the organ's effort rather than exploiting its silence. There is a deeper ethical dimension to this idea. Respecting the liver means acknowledging that strength does not eliminate vulnerability. Just because the liver can endure does not mean it should be forced to. Early testing becomes an act of care, a decision to check in on an organ that works constantly in the background, detoxifying blood, balancing metabolism, and storing essential nutrients. The test is a way of saying that silent labor deserves attention, and that health is not only about responding to pain, but about protecting function before it is lost. This silence also contributes to misunderstanding and stigma. Many people associate illness with visible suffering, assuming that absence of symptoms equals absence of disease. Hepatitis C challenges this assumption. The virus teaches us that health and illness can coexist for long periods, and that the body often negotiates balance quietly. Early HCV testing reframes the narrative from one of sudden illness to one of gradual awareness. It replaces surprise with preparedness and fear with informed choice. On a human level, early HCV testing reflects maturity in how we approach our own bodies. It requires trust in science and respect for processes we cannot feel. Choosing to test without symptoms is an acknowledgement that well-being is not just a present state, but a future responsibility. It is an acceptance that prevention and early detection are forms of self-respect, not signs of weakness. In this way, the HCV test becomes more than a diagnostic tool. It becomes a gesture of gratitude toward the liver, recognizing its quiet endurance and choosing to protect it while it still has the strength to heal and adapt. The HCV test listens to the immune system's memory rather than waiting for visible illness, and this idea alone reshapes how we think about health and disease. Inside the human body, the immune system is not merely a defense mechanism reacting to danger in dramatic ways. It is also an archive, a living record of encounters that may have passed quietly without pain or warning. When hepatitis C enters the body, it often leaves no immediate trace that a person can feel. There may be no fever, no weakness, no signal strong enough to interrupt daily life. Yet the immune system notices. It studies the virus, recognizes it as unfamiliar, and creates antibodies as a form of remembrance. The HCV test does not search for damage or destruction first. It searches for this memory, this subtle biological imprint that says something once crossed the body's path. This approach reflects a deeper scientific humility. Instead of waiting for organs to fail or symptoms to force attention, the test acknowledges that the body often knows long before the mind does. Immune memory is a quiet intelligence shaped by evolution to protect us in advance rather than in retrospect. By detecting antibodies, the HCV test reads this intelligence, translating microscopic history into meaningful information. It tells a story of exposure, not accusation, and in doing so, it shifts medicine away from crisis management and toward early understanding. There is also something profoundly human in this process. Memory, whether biological or emotional, shapes outcomes. Just as past experiences influence future decisions, immune memory influences how the body responds to future threats. The HCV test respects this continuity. It does not ask whether a person looks unwell today. It asks whether the body has been challenged before and how it responded. This perspective reduces blame and fear, replacing them with curiosity and responsibility. A positive antibody result does not mean current illness. It means the immune system once stood alert and responded, which is an act of strength rather than failure. Scientifically, this method allows intervention at a stage when healing is still possible and often highly effective. By listening to immune memory, healthcare moves upstream, closer to cause than consequence. The liver may still be functioning well, inflammation may be minimal, and yet the test has already opened a window into what could unfold if left unseen. This early awareness is not about labeling people as patients, but about giving them knowledge while time is still an ally. On a philosophical level, the HCV test teaches patience and attentiveness. It reminds us that not all truths announce themselves loudly, and that some of the most important signals are the ones that require careful listening. The immune system whispers its experiences through antibodies, and science has learned to hear those whispers. In that exchange, medicine becomes less reactive and more reflective, honoring the body's inner record and trusting that understanding memory is often the first step toward preserving health and balance.